Hi, everybody. My name is Mallory Brooks, and I chose to write my research paper on the topic of abortion. An abortion procedure is extremely controversial throughout society as well as in the healthcare field. Many often question when life begins, making it difficult to answer the question of if it is considered to be ethical. Other things like the unique situations of the mother come into play when considering abortion to be ethical, such as an instance of a poor pregnant woman who cannot afford to support a child, let alone pay the hospital bill to birth that child. I believe it would be considered unethical to force debt onto someone like that who cannot afford it. Others would argue that terminating the fetus is more unethical than that, however. There's always going to be disagreements about this topic, and that's what makes it interesting to discuss and an important topic to discuss within the medical field. The reason I chose this topic is because it interests me to have an open discussion about a topic as serious as abortion, because abortion rights are constantly debated. I think it's important to have open dialogue on the topic in order to better understand the views on both sides. As future healthcare professionals, we must be open to discussions on such topics. I personally am very, very pro choice. I believe it's up to the person who's pregnant to decide what happens to their body. I think an individual's bodily autonomy is an extremely important aspect of human rights, and I believe the person who is pregnant should always come before the fetus. I actually wore these earrings of women's bodies to discuss women's bodily autonomy, so I thought that was appropriate. Um, there is the question on when personhood begins, which is a big determinant on whether abortion is ethical or unethical. Since the woman who is pregnant is already without a doubt a person, I believe we should prioritize her life first. Another reason I chose this topic is because I'm hoping to be accepted into the diagnostic medical sonography program. I actually applied very early. I applied on the first day that it opened, so fingers crossed. And so hopefully to become a sonographer one day. And since sonographers often obtain images on people who are pregnant, I thought the topic of abortion related to this because I could possibly have a patient who is pregnant and discussing the option of abortion. As a healthcare professional and by following the code of ethics for diagnostic medical sonographers, I would perform the procedure in a non judgmental fashion as well as respect the patient's autonomy. This first code of ethics for sonographers prevents any judgment against the patient and promotes overall patient well being. I would make sure all of my patients felt completely comfortable in my care, regardless of their choice on what they decide to do with their pregnancy. The several ethical issues that I discuss within my paper include autonomy, the divine command theory, rights, ethical relativism, the standpoint theory, generational theory, and consequence oriented theory versus duty oriented theory. I chose to include more than five ethical topics because I just kept thinking more and more about different ethical topics that I could discuss. I kind of just couldn't stop thinking about um, the different topics. I had to shorten up my paper a bit so it wouldn't be too long. I dove into most detail with consequence oriented theory versus duty oriented because I actually came up with my own example to explain how a healthcare professional would make a decision through both of these theories. So, in short, the example I came up with, it consisted of a religious doctor whose state allows them to refuse performing abortions, but a pregnant woman comes in with an active addiction and she wants an abortion. I think this was a good example to be able to explain how that doctor would come about making a decision through both of these processes. It also sort of tied into the divine command theory because it involved a religious doctor. Specifically for my field of study, sonography, the code of ethics for that career include one in particular promoting patient well-being that ties in really well with the discussion of abortion. So I actually talked about this in my paper, how as a sonographer, I must recognize the patient's individuality and provide care in a non-judgmental and non-discriminatory manner. I went on to discuss how if a pregnant woman came in for an ultrasound, and she began discussing her options of terminating her pregnancy, then if I were to disagree with her, then I would not be following the code of ethics for that career because I would not be providing care in a non-judgmental way. To abide by that code, I would not comment on my patient's personal decisions on what she will do with her pregnancy. This also ties into the ethical topic of autonomy, which is when someone has the right to decide what to do with their own body. I learned with this paper that it's vital to have an open discussion about abortion and to not let your personal views get in the way of being a medical professional. I believe that as a healthcare provider, you should always respect patient wishes and their bodily autonomy when it comes to abortion. You never know what someone is going through in their life that leads to the decision of terminating their pregnancy. I learned that even though I may disagree with someone who doesn't support abortion, and even though I'll never understand why someone would be opposed to a woman having control over her own body, that doesn't mean they have any ill intentions. They just see the other side of abortion. They see the unborn baby or fetus as something to be prioritized rather than the mother. And just because you, as a healthcare professional, may disagree with abortion, it's still your duty to provide care in the most non judgmental way and to always provide a safe space for your patients to feel comfortable discussing this topic with you. It is an intimate topic to discuss and not an easy one by any means. I really enjoyed writing this paper and presenting this video to you all. I'm looking forward to seeing what everyone else wrote about and to see what you think about what I wrote about and about this video. Thank you for taking the time to watch this presentation, and I hope you all have a great rest of your day. Bye.